As a vascular surgeon and medical researcher, I have spent more than 4 decades studying why mobility quietly disappears in older adults. And if there is one condition I consider both dangerous and deeply underestimated after the age of 60, it is poor circulation in the legs. Not because it causes immediate pain, not because it announces itself loudly, but because it progresses silently, slowly, and invisibly until strength, balance, and independence are already slipping away. In my surgical practice, I have operated on countless patients who came in with what they believed were harmless symptoms: heavy legs, cold feet, mild swelling around the ankles, occasional nighttime cramps, a subtle tingling or numbness that came and went. Most of them were told the same thing: this is normal aging. Just move more. Try walking every day. But when we looked deeper, the truth was far more concerning. By the time these patients reached my operating room, many had already lost a significant portion of the blood flow required to properly nourish their leg muscles, nerves, and connective tissues. And the most troubling part was this: their bodies had been warning them for years. They just did not recognize the signals. Poor circulation does not fail all at once. It weakens gradually. The smallest blood vessels are affected first. Oxygen delivery declines. Waste removal slows. Muscle tissue becomes undernourished. Nerve signaling becomes dull and delayed. And because this process is slow, the brain adapts. What once felt abnormal begins to feel normal, until one day standing up feels harder. Walking feels less stable. Balance feels unreliable. And independence begins to erode. In our research laboratory, we studied why this happened so consistently after the age of 60. And what we discovered surprised even us. Simply walking, the activity most older adults rely on to maintain leg health, does not adequately activate the deep vascular channels responsible for delivering oxygen-rich blood to the muscles of the lower leg. Walking keeps you moving, but movement alone is not enough. You see, your circulatory system relies on pressure changes, and it relies on targeted muscle contractions, and it relies on something most people have never been taught: the activation of the deep calf pump and peripheral vascular network. When circulation begins to decline, arteries become less responsive. Blood pressure within the lower extremities drops, and the smallest capillaries become compromised first. That is why numbness and tingling often appear before pain. The nerves are starved before the muscles fail. Over time, this leads to weakness, slower reaction times, poor balance, and an increased risk of falls. In fact, multiple studies now show that reduced leg circulation is one of the strongest predictors of mobility loss in adults over 60. Stronger than muscle loss alone, stronger than joint stiffness, and stronger than body weight. Yet most people are never taught how to recognize it early, and even fewer are shown how to reverse it. One of the most common misconceptions I hear is this: I walk every day, so my circulation must be fine. But walking uses a repetitive, familiar movement pattern. It does not create the pressure gradients needed to reopen dormant blood vessels. It does not challenge the calf muscle pump deeply enough. And it does not stimulate the growth of new capillaries. Think of it this way: walking sends blood down the main highways. But the side streets, the small roads that feed your muscles and nerves, remain neglected. As circulation weakens, your body begins to compensate. Your lower back works harder, your hips stiffen, your knees absorb more stress, and your feet lose sensitivity. And this is why many older adults experience instability without understanding why. It is not simply aging, it is not inevitable, it is a circulatory problem. Research published in vascular medicine journals has shown that once blood flow to the lower extremities drops below a certain threshold, muscle fibers begin to change. They shrink, they fatigue faster, and they recover more slowly. At the same time, the nervous system becomes less efficient at sending signals to those muscles. This is why older adults often say, "My legs just don't respond the way they used to." The problem is not effort, it is communication, and communication requires circulation. When we began testing targeted circulation exercises designed specifically for older adults, the results were remarkable. Blood flow increased measurably within minutes. Swelling reduced within days. Muscle responsiveness improved, and balance scores increased significantly. We placed sensors on patients' legs, Doppler ultrasound probes, oxygen saturation monitors, and what we observed forced us to repeat the experiments multiple times to confirm the results. Properly designed movements could reopen deep vascular pathways that walking alone never touched. This is why in this video, I will reveal 5 science-backed exercises that surgeons and vascular specialists recommend for poor circulation after 60. These are not gym workouts, and they do not require equipment, and they are not based on intensity. They are based on physiology, and I want you to pay close attention. Because the second exercise in this series has been shown to help reopen the deep blood vessels responsible for strength, endurance, and resilience in the legs. Before we begin, I want to ask you a simple question. Where are you watching from today? Let us know in the comments below. We read and respond to every message because this is not just a video. It is a community built around preserving mobility, strength, and independence. Now let us begin with exercise number 5. Because while it appears simple, it activates circulation in a way most seniors never expect. Number 5, standing heel raises using the progressive hold technique. At first glance, the heel raise seems almost too simple to matter, but when performed correctly, it becomes one of the most powerful circulation tools available to the human body. Your calf muscles function as a secondary heart for your legs. Medical professionals call this the calf muscle pump. Every time these muscles contract, they squeeze blood upward against gravity, pushing it back toward the heart. Inside your calf muscles are specialized valves. These valves prevent blood from flowing backward. And when you perform heel raises with proper timing and control, you create a pressure differential that significantly increases venous return. Research from the University of Pennsylvania has shown that targeted calf contractions can increase venous return by up to 40%, but only when performed correctly. To perform this exercise, stand with your feet hip-width apart. Distribute your weight evenly across the balls of both feet. Slowly rise up onto your toes while counting to 3. At the top, hold for 2 full seconds while consciously squeezing your calf muscles. Imagine you're trying to crack a walnut between them. This mental cue improves muscle activation and blood flow. Then lower yourself back down over another 3-second count. Do not fully relax at the bottom. Maintain tension. The progressive element is what transforms this exercise. Each week, increase your hold time at the top by 1 second. Eventually working up to a 10-second hold. This extended contraction creates metabolic stress, and metabolic stress signals your body to grow new capillaries. New pathways for blood flow begin with 3 sets of 15 repetitions. Perform this exercise twice daily, once in the morning to restart circulation after lying flat overnight, and once in the evening to counteract blood pooling from sitting or standing during the day. Many patients report feeling warmth and tingling in their legs within minutes. This is not pain. It is oxygenated blood returning to areas that have been deprived. For added benefit, perform this exercise barefoot on a slightly elevated surface. A thick book, a low step. This increases range of motion and further enhances circulation, and this is only the beginning because the next exercise targets blood flow in a completely different way, one that addresses stagnation caused by prolonged sitting. But we will get to that shortly. For now, take a moment to notice how your legs feel. Circulation does not change silently. When it improves, your body lets you know. And in the next section, we will build on this foundation, moving deeper into the system and awakening pathways that may have been dormant for years. Now let us move to exercise number 4. This is where circulation improvement becomes noticeably deeper and more structural. Number 4. Seated leg extensions combined with ankle flexion. At first, this movement looks like a simple leg exercise. Most people associate leg extensions with strengthening the quadriceps. But when performed correctly and combined with deliberate ankle flexion, this movement becomes a powerful circulation accelerator that targets areas most affected by aging. One of the greatest circulation problems in adults over 60 is something vascular specialists call venous stasis. This occurs when blood pools in the lower legs during prolonged sitting. And according to CDC data, adults over 60 sit an average of 8 to 10 hours every day. When blood pools, oxygen delivery slows. Waste products accumulate, swelling increases, and pressure builds inside the veins. Over time, this damages the vessel walls and it weakens valves, and it reduces the speed at which blood can return to the heart. This is why many older adults notice that their ankles swell by the end of the day. or that their feet feel cold even in warm environments, or that standing up after sitting feels stiff and unsteady. The seated leg extension with ankle flexion addresses this problem directly. When you extend your leg while simultaneously pulling your toes back toward your shin, you activate a muscle called the tibialis anterior. This muscle runs along the front of your lower leg and plays a critical role in pumping blood upward. At the same time, you are contracting the quadriceps, compressing deep veins in the thigh. This creates a coordinated pumping action from hip to ankle. Research using Doppler ultrasound has shown that this synchronized contraction pattern can increase blood flow velocity by more than 50% when performed continuously. To perform this exercise, sit in a sturdy chair. Keep your back straight. Place both feet flat on the floor. Slowly extend one leg straight out in front of you. As you reach full extension, pull your toes back toward your shin as forcefully as you can. Imagine you are trying to pull your toes through your shoe. Hold this position for 3 seconds. During this hold, visualize blood being squeezed upward through your leg. This mental imagery is not optional. Studies in neuromuscular activation show that visualization increases muscle recruitment and circulation. Then slowly lower your leg back down over a 4-second count. Do not relax your foot. Maintain ankle flexion the entire time. This constant tension prevents blood from flowing backward. It keeps pressure moving upward. Repeat this movement 10 times on one leg. Then immediately switch to the other leg. No rest between sides. This creates what I call a circulation circuit. Blood is continuously redirected without pause. Complete 4 total rounds, right leg, left leg, 4 times. Many patients are shocked by how quickly they feel changes. Feet become warmer, skin color improves, tightness decreases, and within a week, ankle swelling often reduces significantly. What makes this exercise especially valuable after 60 is that it improves circulation without stressing joints. There is no impact, no compression of the spine, and no strain on the knees. Even patients with arthritis or joint replacements can perform it safely. For those who want to intensify the effect, light resistance can be added. An ankle weight, a resistance band. But even without resistance, this exercise remains extremely effective because circulation responds more to timing and pressure than to load. Several of my patients reported that chronic nighttime leg cramps disappeared within weeks of performing this exercise twice daily. Others noticed that numbness and tingling became less frequent. These are signs that nerves are receiving oxygen again, and nerves are often the first tissues to suffer when circulation declines. Now we move to exercise number 3, and this is where circulation improvement becomes systemic. Number 3, the wall sit combined with calf pulses. This exercise is based on a principle that surprises many physicians. Isometric contractions, when combined with rhythmic pumping, can improve circulation more effectively than traditional cardio in older adults. An isometric contraction occurs when a muscle contracts without moving. In a wall sit, your thigh muscles are engaged continuously. This creates sustained compression on major blood vessels. When you add calf pulses, you introduce rapid pressure changes. This combination forces blood through vessels that are often partially narrowed or underused. Researchers publishing in the European Journal of Applied Physiology found that this type of exercise not only improves circulation, but also lowers blood pressure in adults over 60. To perform this exercise, stand with your back against a wall. Walk your feet forward about 2 feet. Slowly slide down until your thighs are roughly parallel to the floor. Your knees should be stacked above your ankles. Your back stays flat against the wall. Once in position, begin raising your heels and lowering them rapidly, about 2 pulses per second. This rhythm is critical. Too slow and the effect is reduced. Too fast and control is lost. The sustained thigh contraction restricts blood momentarily. The calf pulses, then push blood forcefully upward. This creates waves of circulation that reach deep into the lower legs. Start with 20 seconds if you are new. Gradually build to 60 seconds over several weeks. Breathe deeply throughout. Inhale through the nose. Exhale through the mouth. Oxygen saturation matters. You want the blood being pumped through your legs to be rich in oxygen. If the full wall sit is too challenging, modify it. Slide down halfway. Or place a stability ball between your back and the wall. After each set, stand up slowly and gently shake out your legs. This allows fresh blood to rush in. Many people report a sensation of lightness and energy afterward. This is not imagination. It is circulation. A study from the Cleveland Clinic found that adults over 60 who performed this exercise daily for 4 weeks improved lower limb blood flow by over 40%. Some participants reported that leg cramps disappeared entirely. Now we move to exercise number 2. This one uses gravity itself to your advantage. Number 2, supine leg cycling with resistance intervals. This exercise is what I call circulation resurrection, because it brings life back to areas that have been deprived for years. By lying on your back with your legs elevated, you reduce hydrostatic pressure. Blood no longer has to fight gravity to return to the heart. This alone improves circulation. But when combined with cycling motion and controlled resistance, the effect becomes profound. Researchers at the National Institute on Aging discovered that this type of movement triggers the release of nitric oxide. Nitric oxide causes blood vessels to dilate. Wider vessels mean faster flow, better oxygen delivery, improved tissue health. To perform this exercise, lie flat on your back. Use a mat or carpet. Raise both legs so your hips and knees are bent at 90 degrees. Your lower back stays pressed into the floor. Begin pedaling your legs as if riding a bicycle. Here is the critical part. Alternate between slow and fast intervals. Pedal slowly for 30 seconds. Make large, controlled circles. Engage your muscles intentionally, then pedal quickly for 15 seconds. Move as fast as you can while maintaining control. This interval pattern creates alternating pressure waves. These waves help clear stagnation inside blood vessels. During the slow phase, imagine pedaling through thick resistance. This mental cue increases muscle activation. During the fast phase, focus on speed and rhythm. Continue this pattern for 3 to 5 minutes. Many patients describe this exercise as feeling like a deep internal massage. Legs feel energized, swelling decreases, restlessness subsides. Because you are lying down, joint stress is minimal. This makes it ideal for people with knee or hip limitations. For advanced progression, ankle weights or resistance bands can be added. But even without equipment, this exercise is extremely effective. Studies from the University of Miami showed a nearly 60% increase in peripheral blood flow after 2 weeks of daily practice. Some patients reported elimination of restless leg symptoms. Others noticed reduced visibility of varicose veins. And now, we arrive at the most powerful exercise of all. The one that consistently produces the most dramatic improvements. Number 1, backward walking combined with toe touch intervals. This exercise challenges the circulatory system in ways forward walking never does. Backward walking activates muscles in a different sequence. It forces your calves, hamstrings, and glutes to work together in unfamiliar patterns. This creates new pressure gradients inside blood vessels. When researchers at the Mayo Clinic tested backward walking in adults with severe circulation problems, the results were astonishing. Blood flow improved by more than 60%. Arterial stiffness decreased, mobility increased. To perform this exercise, find a safe open space, a hallway, a quiet sidewalk. Stand tall, engage your core. Take a step backward, land on your toes first, then roll through to your heel. This reverse pattern creates powerful pumping through the calf muscles. Walk backward for 20 steps. Take longer strides than usual, then stop and perform 5 toe touches. Bend forward at the waist. Reach toward your toes. This movement creates a rapid influx of blood due to gravity and compression. Breathe deliberately. Inhale for 2 backward steps. Exhale for 2. During toe touches, take 1 deep breath per repetition. Repeat this sequence 5 times and the effect is immediate. Warmth, energy, stability. Backward walking requires more energy than forward walking. This forces your body to increase blood flow. It also activates balance centers in the brain, improving circulation regulation even when you are not exercising. Start with 2 or 3 rounds if needed. Use a wall or partner for balance. Progress gradually. Speed can increase over time. Arm swings can be added later. Patients who could barely walk short distances regained confidence. One 72-year-old patient improved his ankle brachial index from high risk to normal within 6 weeks. These 5 exercises work together. They restore pressure, reopen vessels, rebuild communication between brain and muscle. Circulation does not improve by chance. It improves by design. When performed consistently, these movements can transform how your legs feel, and more importantly, how you live. This is not about fitness, it is about freedom. Before we conclude, there is something critically important I need you to understand. Poor circulation in the legs does not happen overnight. It develops silently, slowly, often without pain. That is why it is so dangerous. Most people only notice circulation problems once weakness, numbness, balance loss, or frequent cramping appear. By then, the system has already been compromised for years. But here is the good news. Circulation is one of the most adaptable systems in the human body. It responds quickly when stimulated correctly. And what you have just learned are not random exercises. They are targeted vascular interventions disguised as simple movements. When you perform heel raises with progressive holds, you activate the calf muscle pump. When you combine leg extension with ankle flexion, you reopen deep venous pathways. When you use wall sites with pulses, you force blood through compressed channels. When you elevate and cycle your legs, you reduce gravitational resistance. And when you walk backward, you retrain your nervous system to regulate blood flow more efficiently. Each movement attacks circulation decline from a different angle. Together, they create a compounding effect. This is why patients often report improvements faster than they expect, sometimes within days. Often within 1 to 2 weeks, feet feel warmer, legs feel lighter. Balance improves. End-of-day swelling decreases. These are not cosmetic changes, they are physiological signals that blood is moving again. And when blood moves, tissues heal. Muscles regain strength, nerves regain sensitivity, and joints regain stability. Now let me address an important question many people over 50 ask. Is walking enough? Walking is helpful, but walking alone is not sufficient to restore deep circulation once decline has begun. Walking primarily activates surface muscles. It does not fully engage the deep stabilizers. It does not create enough pressure variation to reopen underused vessels. And it does not retrain the nervous system to correct years of compensatory movement. That is why so many people walk every day and still struggle with weak legs, poor balance, and fatigue. These 5 movements fill the gaps that walking cannot. They are corrective, they are restorative, and they are accessible. You do not need a gym, you do not need machines, and you do not need to exhaust yourself. You need consistency, precision, and patience. This is not about intensity, it is about signaling. Every time you perform these movements, you are sending a message to your body. That message says, these tissues are needed. These pathways must stay open. This system must remain functional. The body listens. Always. Now, let me give you a simple way to structure these exercises. You do not need to perform all 5 at once. In fact, I recommend starting small. Choose 2 exercises, one standing, one seated or lying down. Perform them daily for 1 week, then add a third, then a fourth. Within a month, you can comfortably perform all 5. And by then, many people no longer want to skip them because they feel the difference immediately when they do. Morning is an excellent time. Circulation is lowest after sleep. Even 5 minutes can set the tone for the entire day. Evening is also powerful. It prevents blood pooling, it reduces night cramps, it improves sleep quality. Listen to your body. Mild fatigue is normal. Sharp pain is not. Move slowly. Breathe deliberately. Control matters more than speed. Now, there is one final truth I want to leave you with. Loss of circulation is often mistaken for aging. But aging itself is not the cause. The cause is disuse, misalignment, and lack of targeted stimulation. When you restore circulation, you are not just improving blood flow, you are reclaiming independence, you are reducing fall risk, you are protecting mobility, you are extending the years you can move confidently without assistance. That is what real longevity looks like. If you are watching this and you are over 50, understand this. It is not too late, and it is not your fault. Most people were never taught how to maintain circulation. You were told to walk. You were told to stretch. You were told to accept decline. Now you know better. If this video helped you, share it with someone you care about. Because circulation problems rarely affect only one person, they affect families. And before you go, let me ask you something. Which of these exercises felt most surprising to you? Which one are you most curious to try first? Leave a comment below with your age and where you are watching from. We read and respond to every comment. This channel exists to support people who choose strength, clarity, and movement over quiet decline. Thank you for watching. And remember, strong circulation supports a strong life.